Hello, my name is Carrie Flynn and I will be presenting on leadership management problem of nurse retention. Nurse retention is a problem worldwide. Statistics show that there will be over 250,000 nurses needed in 2020 and that number will rise to over 500,000 in 2025. Issues nurses have are fairly uniform across the board. Nurses state that the nurse-to-patient ratio is too high and it makes it difficult for them to perform their duties and keep the patient safe. There are often issues with staffing, nurses calling out, nurses quitting that cause the schedule to go into disarray, causing other nurses to have to pick up their slack. Nurses also complain about being required to do what a layperson can do, such as stocking, taking out trash. One spends 4 years in college and it's a waste of their knowledge to have them stocking shelves. Nurses complain of poor management with the list of traits addressed here that are deemed corporate psychopathy by Bubiak, Hare, Mathau, and Newman. Nurses also state that it can be hard to get promoted because of favoritism of favoring family and friends. The autocratic leadership style has actually been shown by the aforementioned authors to increase stress among employees, causing decreased job satisfaction and higher nurse turnover. By addressing these issues, nurses will stay in their positions. Increasing education requirements help nurses be better prepared for the job ahead of them. Empowering nurses to have control over their environment, such as putting things in a way that better works with their workflow. As long as the nurse is acting per the doctor's orders and within facility protocol, it's the right way. Micromanaging those that are acting within orders or protocol decreases job satisfaction and increases turnover. And allowing nurses to act within the patient's best interest increases patient or nurse autonomy and work satisfaction. The nurses need to feel supported by their managers. Issues brought to leadership should be addressed quickly, and should they not be able to act on those requests, the management should come to the nurse and let them know why and what to do next. Retaining and hiring of staff to meet the demand of the facility reduces nurses need to have access to equipment that is necessary to take care of their patients. Lastly, by collaborating with physicians as equals, they can provide better patient care. Often nurses feel talked down to not only by physicians but by patients that feel that they are doctor's assistants. And the physicians in the facility need to promote nurses in the public and professional eye. Managers should be screened at the beginning of their hiring and periodically throughout their tenure to make sure that their managerial style is conducive to promoting teamwork. Proper workflow by ancillary staff will reduce the need for nurses to do unskilled tasks. Nurse-to-patient ratios that are set forth by the state needs to be followed, and the hiring and promotion should be done by blind panels to avoid favoritism. Nurses report greater autonomy, have greater job satisfaction. Managers that create a positive milieu with staff and have lower nurse turnover on their units. It was also noted that nurses receive greater amounts of paid time off, reported less job-related stress, and increased job satisfaction. With positive steps in the right directions, nursing shortages and job dissatisfaction can become a thing of the past.